I think it's important for our patients to understand that the body directly correlates to things in the mouth and vice versa.
Yes.
And so we talked about the oral systemic connection when I went to school, but I think that there is a greater focus on it now. And so our patients need to understand that 90% of what goes on in the body manifests itself in the mouth first.
Dr. Joy, thank you for attending Thrive Live. You didn't get to the place you are in hygiene without passion.
True.
When did that passion begin? When did you become interested in dental hygiene?
I became interested in dental hygiene, I just think in dentistry in general as a small child. I had very positive interactions with my dentist when I was small. I was always interested in math and science, and that's dentistry.
Right.
At 16, I started working in the dental office. I needed a summer job.
Right.
And so my mother called my dentist at the time and said, could you please give her a job? And I started front desk. And so for an entire year, because I would still go after school, for an entire year I just got to watch how it was done, front desk, dentistry, assisting. And it was at that time that I absolutely fell in love with dentistry. I fell in love with prevention when I actually went to dental hygiene school. So my dentist, I thought I wanted to be a dentist. And she said, why don't you try dental hygiene first, because you don't want to spend all of this time in school and realize you don't like teeth. And so I went to dental hygiene school, and that's where I fell in love with the preventative aspect of dentistry.
So that's fascinating. There are two important messages that you've just delivered from my ears point of view. The first is that if the professional you see, whether it's a dentist or physician, is someone you like, the chances are you're going to look into that profession.
Yes, yes. Representation matters, and I know we hear that term and it may sound cliche, but for me, born and raised in Washington, D.C., and a lot of the providers that I would typically see didn't look like me at all. So my dentist, she was an African-American woman, Dr. Juanita Rhodes, love her to pieces. I always had positive interactions with her, but she was always just extremely knowledgeable. She was smart, she was professional, and she was well-dressed, and she owned her own practice. So for me, I'm like, wow, if she can do it, I can do it.
So she was a role model.
She was absolutely a role model.
So what's important is that we have role models for young children, because that invariably leads to a career path.
Absolutely.
And we do need people going into dentistry.
We do.
Right, specifically the hygiene area.
Yes.
So that's one.
Yes.
Two, you use the word prevention.
Yes.
As you know, in the United States, 18% of the GDP is spent on healthcare. However, a huge number of people don't really have access to healthcare.
Yes.
And the only way we're going to deal with this is not by putting more people into the hospital dealing with sickness, but preventing people from getting sick.
Absolutely.
And there is a direct correlation between good oral care, good dental hygiene, and healthcare in general.
Yes.
Your thoughts?
So there is a significant body of evidence that really speaks to that oral systemic connection, and there are various factors and various relationships that actually tie oral health to systemic health. And it's interesting that you mention the GDP, the gross domestic product, because I actually spoke to that in my presentation earlier. And what we're finding is that what people are spending on oral health care is declining every single year. And so that is, we're going to face an oral health care crisis. And another thing that I spoke to in my presentation is that 6 out of our 10 patients have one chronic disease, 4 out of 10 have 2. So that means that if we're seeing on average 10 patients a day, half of those patients, if not more, are coming to us compromised. I think it's important for our patients to understand that the body directly correlates to things in the mouth and vice versa. And so we talked about the oral systemic connection when I went to school, but I think that there's a greater focus on it now. And so our patients need to understand that 90% of what goes on in the body manifests itself in the mouth first. And so from a preventative aspect, hygienists, we're prevention, we could be the ones to save a life.
Yes.
We could be the one to help prevent something.
Right.
We could say you need to see your physician, or maybe you need to change your lifestyle based on what I'm saying. So there's just so much opportunity in the area of prevention.
Well, I think it's critical. We touched on two important points. The one is to encourage young people to go into hygiene,
Yes,
and it's the mentor that counts.
yes,
And since almost 50% of Americans now, in one way or another, will trace our roots to the developing world, we need to make sure that the hygienists and the dentists are representative of the American population.
absolutely.
And the way that starts is with mentors.
With mentors, and when we talk about representation, it has to be in action, not just words. And so even
Yes.
some of the imaging that we're
Yes.
using needs to be reflective of that. Simply having me here, oftentimes I go to these conferences and there's not a lot of representation. And then I'll find people that will come up to me quietly and say, oh my gosh, I'm so glad to see you here. Now I know that I can do this.
Right.
Or just someone simply monitoring the door, checking badges, and they'll say, baby, I'm so proud of you. You make us so proud because we've come so far. So
Right.
representation just means so many different things, and there's so many ways that we can accomplish that.
I'm glad you say that, because that is, to me, very important. Because if we don't get half the healthcare professionals to look like half of the population, we're going to expand the gap in providing
Yes.
healthcare.
Absolutely.
And so that's important. And then, of course, people need to understand why oral care is important, and you're a big advocate for that.
I am. And I feel for many communities 50, 60 years ago and even today, oral health care is considered a luxury,
Yes.
not a priority.
Yes.
And so that means that we have a lot of work to do in terms of educating and changing
Yes.
the value system. Oftentimes people are seeking sick care.
Yes.
And we don't do enough to promote wellness.
Exactly.
And we need to do more of that. And I think that it, not only starts with dentistry, we need to get the medical providers on board as well.
So how do we get the dentists and the doctors, the medical doctors, to talk to each other?
I think we should have more conferences where we meet together.
Yes.
There's medical conferences, and then there's dental conferences, there are
Right.
dental hygiene conferences and
Yeah.
dental conferences. So I think that there needs to be more collaboration amongst the health professions, where it's not just medical or dental, it's
Right.
just a healthcare conference.
We
So
have
I
to-
think there's one way to do that.
Well, we have to go and advocate for that.
We do,
You know,
absolutely.
at Henry Schein, we service both the medical
Yeah.
physician side and the dental side. And what we're trying to do is get the two professions to speak. Often it's a challenge. It starts at the dental and medical school, where
Yes.
they're in different campuses and they don't necessarily talk. But the hygienist, who's playing a key role in prevention, can be a real spokesperson for the importance of oral care as a continuum of care.
I think so. Another thing, I think what hygienists can do is that they can also start submitting to speak at medical conferences. I
Yes.
think that a lot of medical conferences are now more open to that interprofessional collaboration.
Yeah.
And so what we're going to see is more of that crossover, so I'm excited about it.
I can't end without asking you some thoughts on where technology is heading in the dental world.
Oh, it is phenomenal. I think back to from a dental hygiene standpoint, I think back to what my instruments looked like in dental hygiene school. They
Right.
were very thin, they were very heavy. There was just nothing spectacular about them. And we fast forward to 2024, almost all of the dental instruments, the hand instruments, are considering the ergonomic implications of using the tools. So they're bright, they're colorful,
Right,
you'll see
right.
the handles are wider, they're lighter. And so I did, in my presentation earlier, I talked about the benefits of using AI in the hygiene operatory.
Correct.
And how we're able to do more of a comprehensive perio exam.
exactly.
In half the time, we're able to
Right.
detect more disease and detect
Yes.
bones. So
Things that you can't see with the naked eye.
absolutely. So, we discussed the use of robots in
Yes.
surgical procedures. I would love to see what that looks like moving forward.
It's going to
in
happen.
dentistry. Yes.
But AI, just in the image, comparing the image that we
Yes.
take to a database, is resulting in massive amounts of caries being identified.
The other advantages to having the more sophisticated images is that patients understand more of the images. Patients really can't read x-rays,
course.
but they understand pictures.
Right.
And so that speaks to some more of the advantages
Right.
of that technology.
So we are bringing a product to market called Nemotech, where the patient will see what happens if you don't get treated, and what happens if you are treated in photographs on the screen, in movies.
That's like being in a toy store. I would love to play with that.
Well, you may be one of the first to
Oh, I
play
hope
with
so.
Nemotech.
You said it, so I'm going to hold you to that.
You got it. I'm on record.
He's on record.
So, Dr. Joy, thank you
Yes.
for attending and lecturing at Thrive
Thank you.
Live 2024 here in Vegas.
Thank you.
And I look forward to seeing you again soon. Thank
Absolutely.
you.
It was
Please
an
continue
honor.
advocating.
Thank you. It's an honor, and thank you for taking the time to speak with me today.
Thank you. Thanks.
Thank you. All right.
Thank you, Dr.
Thank
Joy.
you.